Cubital fossa. The cubital fossa is a triangular hollow or a triangular space which is situated on the front of the elbow. The boundaries of cubital fossa are laterally it is formed by the medial border of the brachioradialis. Medially it is formed by the lateral border of the pronator teres, and the base is represented by an imaginary line which joins the front of the two epicondyles of the humerus. So this is the cubital fossa. The apex is the point where brachioradialis and pronator teres meet, which is not clear in this diagram. So this is the cubital fossa. Cubital fossa is the triangular hollow in the front of the arm. Laterally it is formed by the brachioradialis, medially pronator teres. Base is the imaginary line joining the two epicondyles of the humerus, and apex is the point where brachioradialis and pronator teres meet. The roof of cubital fossa is formed by skin, superficial fascia, deep fascia, and bicipital aponeurosis. In superficial fascia, there will be the median cubital vein which connects cephalic vein and the basilic vein. And in the roof, lateral cutaneous nerve of forearm, medial cutaneous nerve of forearm are also found. So roof is formed by skin, superficial fascia, deep fascia, bicipital aponeurosis. Superficial fascia contains the median cubital vein which joins the cephalic vein and the basilic vein, and it also contains lateral cutaneous nerve of forearm and medial cutaneous nerve of forearm. The floor of the cubital fossa is formed by the brachialis and the supinator. Brachialis and supinator form the floor of cubital fossa. Contents of cubital fossa are median nerve, brachial artery, tendon of biceps brachii, and radial nerve. So in this diagram you can see the contents of cubital fossa are median nerve. This is the median nerve. Then brachial artery which divides to radial artery and ulnar artery. Then tendon of biceps. This is the biceps brachii muscle, but only the tendon of biceps brachii will be present in the cubital fossa. And then radial nerve which divides into superficial branch and deep branch. So these are the contents of cubital fossa. The median, so first median nerve, this is the median nerve. This is the median nerve. So this median nerve gives branches to flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and this median nerve leaves the cubital fossa by passing between the two heads of the pronator teres, and then the brachial artery. The brachial artery terminates in cubital fossa, and it divides into radial and ulnar arteries. And among these two, radial artery is more superficial and ulnar artery is deeper. The radial artery, once again it gives off the radial recurrent branch. The ulnar artery, this ulnar artery goes deep to both the heads of the pronator teres, and they are separated from the median nerve by the deep head of the pronator teres. The ulnar artery gives off anterior ulnar recurrent branch, posterior ulnar recurrent branch, and common interosseous branches. The common interosseous branch once again divides to anterior and posterior interosseous arteries, And then comes the tendon of biceps. This is the tendon of biceps brachii. Then radial nerve. This is the radial nerve. It descends from medial epicondyle to the lateral epicondyle, and then it enters the cubital fossa. And in the cubital fossa, radial nerve gives deep branch and superficial branch. This is the deep branch and this is the superficial branch. The deep branch is also called as posterior interosseous nerve, and this posterior interosseous nerve gives branches to extensor carpi radialis brevis and supinator, and then it leaves the cubital fossa by piercing supinator muscle. Superficial branch of the radial nerve runs in front of the forearm. And the applied anatomy of cubital fossa is the blood pressure can be recorded by auscultating the brachial artery in front of the cubital fossa, and the median cubital vein, which is present in the superficial fascia of the roof of the cubital fossa, is the vein of choice for intravenous injections. And the median cubital vein is also used for introducing cardiac catheters to get sample of blood from various chambers of the heart. And this cubital fossa anatomy is also useful while dealing with the elbow joint fracture or supracondylar fracture of pelvis.